north-south corridor. The bus ran off the road about 7 this morning, and police are investigating whether it was swerving to avoid a sedan that cut in front of it. Well, because of a new law that takes effect today, some medical emergencies will be handled differently.
Fox 15's Dr. Joette Javinko is here now to explain just how it works.
That's right. The new law is called the Florida Stroke Act. It hopes to help stroke patients get faster treatment so they can have better outcomes.
I was working behind the oven and I stood up all of a sudden and just my whole body went limp.
Calvin Zehnder collapsed at work.
My whole right side, this leg and this arm had no feeling, and I stumbled because my leg wouldn't support me.
Paramedics rushed him to the hospital where doctors diagnosed a large stroke. A blood clot blocked an important artery in his brain.
This is the left middle cerebral artery right here. It supplies 70% of blood flow to this hemisphere of the brain.
And the results can be deadly.
Usually when people have a clot in that particular blood vessel, statistics show their chance of being home and independent of only about 3%. And that is a 97% chance of being seriously disabled or dead.
When it comes to stroke, time is critical. The quicker the response, the better the outcome.
Brain cells are already dying after about 20 minutes.
And doctors must treat a stroke patient with a clot-busting drug as quickly as possible, within 3 to 6 hours. That's why the Florida Stroke Act was passed. The Florida Department of Health provided a stroke alert checklist to all EMS medical directors so emergency responders can quickly evaluate whether a patient is having a stroke. Then, stroke patients must be transported to the nearest certified stroke treatment facility that's capable of assessing, diagnosing, and treating strokes 24 hours a day.
There's no question that if you get to a patient fast enough, like Mr. Zehnder, that you can save a life or actually reduce disability significantly.
This is Kim, my assistant manager, who grabbed me and called 911 that day.
Had it not been for the fast response from his co-worker, paramedics, and hospital, Calvin would almost certainly have had a very different outcome.
If untreated, there was a high probability that he wouldn't be able to speak or understand speech. Additionally, he would have significant weakness to paralysis on the right side of his body.
Instead, Calvin was back to work just months after his stroke.
The symptoms of a stroke include a sudden weakness or numbness in one side, inability to speak, loss of vision, kind of like a shade coming down, sudden loss of consciousness, and a sudden severe headache.
Thanks, Dr. Joe. A Utah woman who sacrificed part